we talk about this a lot now, but when you're talking about a dysregulated immune system, that and any other disease, fasting, whether you do, restricted time eating, where you restrict yourself to certain windows, or you do repeated serial fasts, like a day or two a week, you don't eat for a day. For some, the latter is a lot more difficult, but fasting really kind of triggers the body into a state of like repair and regeneration. It gets rid of diseased cells and tissues, and it's helped to heal a lot of chronic illnesses, and especially and it can even stimulate stem cells. And so we do think a backbone of some sort of fasting, right? We're not really supposed to eat 3 times a day with snacks in between. Giving yourself periods of the day or times of the week where you're not challenging yourself with food will help your body heal. Ivermectin is the backbone to what I do. And by the way, this is kind of my protocol. Our updated protocol has things separated a little bit but these are the kind of things that I'm doing like first line. Ivermectin, I will tell you, my patients, I consider my patient and my practice, I kind of split everyone up into ivermectin responders and ivermectin non-responders. The majority respond to ivermectin to some small, moderate, or large way. When it's a minimal benefit and or they don't respond, I find those patients much more complex, and I'm doing a lot more trial and error. But I've gotten fantastic recoveries with almost ivermectin alone, but we do pair it with other things. So hydroxychloroquine, if I use it in a staggered fashion. I will use it almost as a second line. I don't use it sort of up front, but I will start it within a week or two if I'm not getting the kind of response I want from ivermectin. I put everyone on a regimen of oral vitamin C, at higher doses than what's being used. Obviously in illness, vitamin C is depleted. Absorption kinetics are such that, you really kind of want to take it 3 times a day. And I try to get them to a significant dose, not only for its immune modulating effects, but it's an important source for the microbiome, for the more protective populations of the microbiome. Vitamin C has a big impact. Like Richard mentioned, vitamin D, vitamin K2, low dose naltrexone. I oftentimes will pair that with ivermectin because it has a lot of different impacts. Richard mentioned toll-like receptors, and it's immunomodulatory. And we're getting increasing clinical feedback. I've seen it myself, and others have just found a lot of help in long haul and post-vaccine syndromes. And then we have other just compounds that are really safe, that have a number of different positive impacts, either anti-inflammatory, immunomodulatory. So melatonin, magnesium, quercetin, probiotics, prebiotics, there's many different types out there. I'm now using actually a product from the UK in all my patients because they had a really good trial on it, but it's a combination pre and probiotic. Obviously, omega-3 fatty acids. And then in some, we'll start aspirin, and then I use this kind of natural fibrinolytic enzyme, lumbrokinase. I'm using that. And I've found, some patients will really respond to that. And it's always surprising because I never know which one of these is going to have the impact, but I sometimes get really strong responses beyond what I talked about from like lumbrokinase, and others will swear by Nigella sativa. They're like, when I started that, I started to feel better. And so it's weird. I mean, the one nice thing about doing trial and error with patients is that all of these compounds are like generic, repurposed, and have extremely wide safety profiles. So it's not like you're going to hurt anyone. The anticoagulation is the one that I have a lot of caution around, because I don't want to, I certainly would never want to have anyone suffer any kind of dangerous bleed. What's nice is lumbrokinase is an enzyme which has also a very long and high safety profile.